To set up for the bench press, begin by laying on the bench with the bar approximately over the lower half of your face. Take the bar in an even grip using the rings on the bar for reference. Squeeze your shoulder blades together and down and put as much pressure as you can through your traps on the bench. Bring your feet underneath you, push down through the heels, trying to bridge up onto your traps to create as much pressure across the upper back as possible. To execute the lift, unrack the bar by scraping it out of the J hooks, then squeeze the bar as hard as possible, pulling your chest to the bar as you try to bend the bar in half using your lats. The bar should touch at the lower sternum, and then you can press it through your feet and through your traps, pushing yourself away from the bar as you reach full extension with the hands. This is a full body movement. You are transmitting force from your feet to your traps to the bar, and so you should be very, very tight at every link in that chain. Make sure to keep the forearms vertical, keeping the elbows directly underneath the bar at all phases during the movement. This will allow you to push efficiently up through the bar. Modifications can be made to foot position, where you bring the feet less underneath you and you can drive through the toes of the shoes as though you're trying to make your foot slip out of the toe of the shoe. This will produce a little bit less of an arch in the lower back, so if you have patients who are sensitive into low back extension, this can be a little bit more comfortable for them, but you are still pushing very firmly as though you're trying to slide yourself off the bench, off in the direction of your head. Additionally, if your patient or lifter has shorter legs and cannot effectively drive the feet into the ground, you can use plates or blocks under the feet to raise the floor and bring it up to them so that they can still wedge their feet down and get that same pressure pushing from the feet to the upper back. There are a number of different grips that can be used with the bench press, including narrow grip to all the way out to wider grip positions. Just make sure you use the rings for reference. A thumbless grip is technically possible, but should be reserved for advanced lifters who are very good at wedging the hand into the bar, and make sure to use safety bars to keep that bar off your face and off your throat. Using the lats to try to bend the bar in half will also ensure a secure grip as well as a more distal touch point on the lower sternum. Different options are available if you need to modify the lift for somebody who cannot handle using a straight barbell, from cambered bars to neutral grip bars to elastic assistive devices. All of these can reduce strain on specific joints at different parts in the lift, and it'll still allow you to train the basic movement pattern with heavy enough weight to get a good training stimulus. When spotting the bench press, make sure to communicate with the lifter about their preferred signal to give them a lift off out of the hooks. On their signal, grab the bar, help them float it out of the hooks, and place it over their shoulders. When it is clear that they need your assistance and the bar begins to travel downwards after beginning to travel up, or that the lifter communicates the need for assistance, go ahead and grab the bar, pull it straight up towards the ceiling, allowing the lifter to reach full lockout before you help them put it back into the hooks. Do not yank the bar out of the hooks and drop it on the lifter when you're spotting them. This will pull them out of position and they will not be able to recover a good position for the lift. Key points on the bench press: shoulder blades should be packed back and down and driven into the bench. This is your main point of contact with the earth. You need this to be as stable as possible. Leg drive will help to push into the traps in order to make that upper back much more stable. Squeeze the bar as hard as possible, trying to bend it in half. On the way down, pull your chest into the bar instead of lowering the bar to your chest. And instead of pressing the bar away, think about pushing yourself away from the bar.